Hi, my name is Eleanor Tatum, and I'm the publisher and editor-in-chief of the New York Amsterdam News. The coronavirus crisis has brought serious distress to local economies and advertising along with them. The New York Amsterdam News has partnered with the Local Media Association during this unprecedented crisis. Help us continue our important work in chronicling the life of Black New Yorkers, and consider making a donation to the COVID-19 Local News Fund today. Go to givebutter.com/Amsterdam News. Again, that is givebutter.com/Amsterdam News. Thank you and stay safe.
It's Thursday, April 23rd. Welcome to a special edition of the New York Amsterdam News Podcast. I'm Cyril Josh Barker. We continue our coverage of the COVID-19 outbreak with my guest, New York City Mayor Bill de Blasio. He's going to be speaking with me about how the COVID-19 pandemic is impacting the city, particularly in the Black community. The first case of COVID-19 was confirmed in New York on March 1st. As of April 23rd, there are over 138,000 cases of COVID-19 and nearly 15,000 people have died from the virus. The coronavirus is hitting the city's Black and brown communities the hardest, with numbers from the city's health department indicating that zip codes in Harlem, the Bronx, Central Brooklyn, and Southeast Queens have the highest numbers of cases. This week, the city opened several testing centers in Black neighborhoods in an effort to slow down the spread. And we welcome you to this episode of our podcast, this special episode of our podcast with Mayor Bill de Blasio, who will be on with me in a moment. As I said before, he's going to be speaking with me about the latest, what's going on with the coronavirus, as well as how it's particularly hitting the Black communities in our city. So we're looking forward to having him. The paper did come out today. It is Thursday, and so we have several stories that we want you all to check out in the paper as well as online. The first one is the very issue that I'm talking about, African Americans being disproportionately affected by COVID-19, which is our front page story. Blacks make up 22% of the city's population, but 22% of COVID-19 deaths, and several Black leaders in the city, including public advocate Jumaane Williams, have some things to say about that, and so you can definitely check that out. The other front page story that we have is a story about subway and buses and the MTA public transit and how it's possibly a culprit for spreading coronavirus. A group of about 4 city council members want to shut down the subway system and bus system for about a week for a deep cleaning, but the MTA and the mayor are saying no because obviously essential workers have to use public transit to get around. And another story that we have, which is by our editor, Nyaba Arinde, is about the passing of Black businessman Jonathan Adewumi, who died on April 17th from coronavirus. His family says that they tried to get tests in Brooklyn at some hospitals, I think it's about maybe 2 or 3, and they could not get him a test. He was not able to get a test for COVID-19. He actually ended up having to go to New Jersey to be tested, and he tested positive, and sadly he passed away. So our prayers are definitely with his family at this time. Just have to make an announcement that the podcast is now on TuneIn. I know there's a lot of great music, and a lot of people use TuneIn to listen to music and some other items on there, and we hope that you can listen to us on there too. You can go on TuneIn and put in New York Amsterdam News Podcast, and we'll be right there. We hope that you add us. So welcome to our TuneIn listeners. Well, my guest today is New York City Mayor Bill de Blasio, who's going to be speaking with me today about how COVID-19 is impacting the city and what's ahead. This is his first time on the podcast, and we are so happy to have him. Welcome to the podcast, Mayor de Blasio. How are you?
I'm doing okay, Josh. We're all going through a lot, but I'm hanging in. How you doing?
I'm doing the same, just hanging in there. Well, first and foremost, I do want to ask you about a concern that a lot of our readers have and a lot of people in the city have, and that is how COVID-19 is impacting the Black community here in New York. What are your words on that? Can you share your thoughts on how that's being handled?
Yeah, we're seeing a really disturbing disparity where people of African descent are being hit very hard by this disease, disproportionately hard, and it goes back to a lot of things we all know too well. It goes back to massive disparities in healthcare predating this crisis, the fact that healthcare in this country is given out according to income and, is not universal the way it should be, and the fact that, all the structural racism and everything we're all fighting against has left so many people of African descent vulnerable in this crisis. And it's pointing out a really painful illustration of how we have to do things very differently in the future. The city's already trying to make a lot of changes, but there's more we have to make. But the country, for this country, it's like a total clear wake-up call that we're dealing with unacceptable healthcare disparities, and we need a very, very different approach to healthcare going forward.
All right. Thank you so much. And also, tell us a little bit about what's going on to slow the spread of coronavirus. People are still social distancing. Businesses are closed. Tell us what's being done to stop the spread.
Yeah, Josh, the most important actions, closing down those non-essential businesses, closing down the schools, closing down bars and restaurants, all of that, while requiring people to stay home to the maximum extent possible and to practice social distancing and enforcing the social distancing, all of that has really added up. The reason we are finally able to say that our healthcare system has held through this crisis, our healthcare workers have held, was because New Yorkers did the right thing and really followed those standards, and it helped us begin to turn the corner. But the big question is, where do we go from here? I think what you're going to see is the month of May now becomes decisive. We've got to hold on to this kind of tough, disciplined approach while bringing into play a lot more testing and the kind of test and trace approach I talked about the last few days. That means heavy contact tracing. If someone is tested, is positive, or has the symptoms, we want to know who they were in close contact with so we can go and test those people too, and isolate and quarantine anyone who needs it with a lot of support. And this is going to be a very aggressive plan, unlike anything you've seen so far in the United States, anything you've seen in New York City historically. We're talking about, we're going to be doing tens of thousands, and then I hope hundreds of thousands of tests per day eventually. We have tens of thousands of hotel rooms ready to help people with isolation and quarantine. It's going to be very aggressive, and May is going to be decisive, because this is when we bring all this online to the maximum extent possible. The big X factor here, Josh, is do we get the kind of testing capacity we need? Right now, only the federal government could help us do that. They've failed miserably throughout. We're finding some test capacity of our own. We're building that up, but we really need profound amounts of federal involvement to get this testing capacity up to where we need to really shut this disease down, and that is still not something that we can have any guarantees around.
Right. And I know that you recently put testing sites in some of our black and brown neighborhoods in Harlem and Brooklyn, in the South Bronx and in Southeast Queens. Can you give us a progress report on how that's going? Are more people getting tested? Are more people taking advantage of it? And how is it going overall?
It's going really well. I mean, we've put up now the 5 centers that are part of our health and hospitals, our public hospitals, including East New York and Brooklyn, Vanderbilt Health Clinic in Staten Island, Queens Hospital in Jamaica, Sydenham in Harlem, Morrisania in the Bronx. They're getting a good response, and it's just starting. I mean, the word is spreading rapidly, and more people are coming in. Obviously, free tests, walk-up tests, with a focus on people not only from the community, but who have those pre-existing conditions or are older, who are most vulnerable. We got 5 other sites that we are doing with the 1199, Local 1199, SEIU, the Healthcare Workers Union. We're doing that for their members, but also for the larger community. And then a new set of sites that are opening now, also going to be at health and hospital sites in Fort Greene, Brooklyn, Mott Haven in the Bronx, and the Lower East Side, plus sites that will be specifically in public housing developments, Jonathan Williams houses in Williamsburg, Woodside houses in Queens, St. Nicholas houses in Harlem.
Okay.
So we're expanding this grassroots testing rapidly, and the goal here is that this is going to really be in the front of our efforts to fight the disparity, but it's only a kind of a vanguard of something much, much bigger, where I want to see us not increase by thousands of tests a day, but citywide by tens of thousands of tests a day. And again, ultimately, if I had my perfect world, it would be we could do hundreds of thousands of tests a day to really shut this disease down.
Right. You recently made the decision to close school for the rest of the year. I know that was a difficult decision. We've been hearing from a lot of families about how they're dealing with it. One of the main things that we're hearing is that there's still some students that don't have the materials and necessary things that they need to do remote learning. First of all, can you elaborate a little bit on your decision to close the schools for the rest of the year and about how more hardware is being given to students in the city?
Yeah, Josh, it was a very tough and painful decision because I understand, I was a public school parent for all of my kids' education. I understand how much parents rely on the schools for everything, for a safe place for the kids, the education of the kids, food for the kids, you name it. And the way parents are working, such long hours, it's one of the things that they really rely on. So I really tried to see if there's any way we could keep school going. It proved to be impossible. And what we said is, look, we're going to have to start an online learning system from scratch, to do something for 1.1 million kids that's never been done before. Mm-hmm. We're making progress, but it's still a work in progress. And the one thing that has been clear is every child that needs a device, every child who does not have what they need, either the actual device or the internet service to participate in online learning, it'll be given to them for free. The Department of Education is doing that as we speak. We got 300,000 iPads in from Apple, mm-hmm. and we're distributing very quickly to kids who need them. That's gone really well in the last few weeks as more and more of the iPads have come in. The problem is there are some kids we haven't heard from, some families we haven't heard from who still have a need. So I want you to please get the word out. Mm-hmm. Just call 301. If you're a family of a public school child who doesn't have a device or doesn't have internet service, all you have to do is call 311. Mm-hmm. And we can get it to you quickly. Okay. So we've got the devices now, finally. We need to make sure we reach everyone who still hasn't come forward and needs them.
Okay. One other thing a couple of things I want to talk about. Well, the other thing was about the small businesses. Small businesses are suffering right now, and they need help, and, employees need to get, keep working. And I specifically want you to talk about the New York City Small Business Continuity Loan Fund, which is aimed at helping out a lot of our small businesses.
Yeah, so we put that loan fund and a grant program out too. The loan fund was for businesses of 100 employees or fewer. The grants were for the smallest kind of mom and pop, 5 employees or less. And we devoted about $50 million early on in this crisis. We got a huge number of applications, and so we're going to be putting all that money out rapidly. It will all be used up quickly for sure. And what we're seeing so far in the loans and grants is that about 30% are going to MWBEs, to minority and women-owned businesses, which is something we want to make sure is, continues to deepen, because that's consistent with the larger goals we had before COVID-19 of getting more and more city contracts to MWBEs. That 30% goal is actually what we've been trying to achieve with billions and billions of dollars of city contracts, and we're getting closer to it all the time. So it's a very sad situation we're all dealing with, but at least it's good that these loans and grants are going out rapidly, and they're reflecting our whole city and our whole community.
Okay. And we're starting to see some signs that things are starting to get back to somewhat of normal. I know that the announcement was made that the USS Comfort was, had left the city. There's no longer a need for that. And that marinas were open recently here in New York. Which is a little glimmer of hope for a lot of people who want things to get back to normal. But the question that on everybody's mind is, when will we be back to normal? When will we be able to not be working from home, not social distance, going back to school? And how is that process going to look? Because, some cities are kind of speeding it up a little bit, maybe not in the best way that they should. But what is it going to take for New York City to get back to some type of normalcy?
Yeah, Josh, this is the most sort of fundamental question. I hear it from so many people. First of all, I'm very concerned about some of the states that are rushing to reopen, and yes. I don't mm-hmm. have, I don't live there. I don't see everything that's happening there, but what I'm hearing from people in those states is a deep concern that their leaders are making decisions more about political considerations and economic considerations, and rather than protect the lives of their people. Mm-hmm. And that worries me a lot. Here we are taking a very careful, cautious approach because we've seen the devastating impact here, and we're not going to let this disease reassert. We're starting to beat it back. Our healthcare workers have done amazing work beating back this disease, but the people have too. But it's taken a lot of consistency. So my point would be, first, one of caution. We're on the right track. We got to stay on that track. We cannot take our foot off the gas.
Okay.
The second thing I'd say is I look sort of to the beginning of school as the time I feel the most confident about, meaning to say, we said we'd start school in September. That gives us a lot of time to create the right approach to starting school where people can feel safe about it. Obviously, testing is going to be crucial to that. When you work back from there, the way I'd say it is, in May, we go into heavy testing and contact tracing.
Okay.
That's going to help us constrain this disease. So I know what we got to do in May, and I know it's going to take time to achieve the further beating back of the disease. I feel very good about things getting substantially back to normal by September. So the question becomes, what happens in those middle months, June,
Right.
July, August? How fast can we go? And that's the great unknown. I think if we have really great discipline from New Yorkers and great success with building up testing and contact tracing, that's going to go faster. If that's not, if we don't have enough testing, for example, if the federal government doesn't step up and there's just not enough testing, it's going to go slower. But somewhere between, the end of May and the beginning of school is going to be the point where we start to loosen up.
Okay. And will that happen in stages? Because are you going to, have you thought of a plan yet that's going to open the city in a process? Because obviously we can't flip a light switch on and have everything open at the same time. But is that being thought about? Is that being put in place? What's going on with that?
Unquestionably, as you said, it's going to be stages. There is no flipping of the switch. You're absolutely right. It will be slow, careful stages. I don't mean slow like we want to take more time than we need. What I'm saying is we're going to make decisions based on facts, and we're putting out these indicators all the time that people can see every day.
Mm-hmm.
All New Yorkers can see them together and know where things are going. Mm-hmm. When we get to a certain point of improvement, we have these three leading indicators that I talk about each morning. When those improve for, give or take 2 weeks, is when we can anticipate some initial loosening up. But again, it also depends on people staying with the rules we put out for now and living by them. Depends on getting more testing in. All of it's going to be sort of interactive. We're going to watch it all every single day. But at some point, if things go well, we say, okay, certain things now can loosen up some more, mm-hmm. and then we see how we do with that. If that goes well, then you loosen up some more and sort of go in stages with, I hope, the end point being no later than the start of school, where we get to something that really feels much more normal. But again, maybe with hard work all around, we could get there much sooner.
Right. All right, Mayor de Blasio, my last question for you is, what's your message to New Yorkers? People are dealing with a lot of different things, some of these things at the same time, job loss, illness, lack of finances, several things. What is your message to New Yorkers at this time as we go through this COVID-19 pandemic?
Most important message is that New Yorkers have been heroic, not just the healthcare workers and the first responders, but everyday people have shown a lot of fight back and a lot of spirit, and also have really adapted to these tough new rules. And that's the only reason why we're fighting back this disease, is what everyday people have done. So I just give my deepest appreciation to all New Yorkers for that. I'd say for all the folks hurting, and it's a huge percentage of the city that's hurting right now, the city is there for you, especially for folks who are hungry. Just call 311. We'll get you food or tell you where you can get food in your community. For folks who need medical help, just call 311 and we can connect you to our public hospitals and get you the help you need. We're really trying to step up in a very energetic way and forceful way to get people what they need. But the biggest question going forward is, will the help be there from Washington? We need two things from Washington. We need testing, mm-hmm. really pervasive testing, and we need that stimulus bill to make New York City whole so we can afford to give people all the services that they need. Right. And we need to fight for that. And that's going to be in May. That's going to be a decisive moment, whether we get what we deserve or not. So that's what we're working on right now. But I can say that the city we're going to give everything we got to keep people safe, to keep them healthy, to get them food, keep a roof over their head, protect where they live and their ability to keep living there. We can't do everything the federal government can do. We need them to step up, and we need to keep pounding a way to get them to step up to fill in the rest of the equation and really help people back. And the last thing I'll say is there's going to be an opportunity here, not just to restart and to recover, but to transform.
Okay.
I don't want to see New York City go back to the status quo before COVID-19. We were doing some good things as a city for sure, But that status quo before COVID-19 is not acceptable to me. Those disparities that became so sharp are not acceptable to me. We have to see it as a transformative moment. And you think about moments in history, the Great Depression is a very powerful example, horrible, painful moment, but out of it came some of the biggest changes that we're still feeling in our lives now in a direction of economic justice, social justice, and dare I say, we need racial justice to be front and center in this equation. So don't see it as just restart. We have to see it as restart with transformation.
All right. Well, listen, Mayor de Blasio, I really appreciate you being on the podcast, and thank you so much for being here.
Thank you, Josh. Hang in there.
That concludes this week's podcast. You can pick up the latest edition of the New York Amsterdam News on newsstands and get updates online at amsterdamnews.com. You can also keep up with us on Facebook at NY Amsterdam News and follow us on Twitter at NYAmNews. I'm Cyril Josh Barker. Thanks for listening.
Hi, my name is Eleanor Tatum, and I'm the publisher and editor-in-chief of the New York Amsterdam News. The coronavirus crisis has brought serious distress to local economies and advertising along with them. The New York Amsterdam News has partnered with the Local Media Association during this unprecedented crisis. Help us continue our important work in chronicling the life of Black New Yorkers, and consider making a donation to the COVID-19 Local News Fund today. Go to givebutter.com/Amsterdam News. Again, that is GIVEBUTTER.com/Amsterdam News. Thank you and stay safe.